Hypertension Awareness Series Episode 6B. Good morning. Masked hypertension. When the clinic BP says normal, but the home BP is high. Masked hypertension is one of the most dangerous and underdiagnosed forms of high blood pressure because it hides in plain sight. Your clinic readings may look normal, but your blood pressure is consistently high at home or during your daily life, the opposite of white coat hypertension. Masked hypertension, when does it occur? It occurs when your clinic or hospital BP is less than 140 over 90 millimeters of mercury, but the home BP is more than 135 over 85, or the 24-hour ambulatory BP monitoring is more than 130 over 80. Both the patient and doctor may think all is well, while the damage occurs because most of the time at home your BP is high. Why is masked hypertension dangerous? Because it goes undetected for years. And studies show that many people with masked hypertension have similar risk of stroke and heart attack like people with sustained hypertension. They have higher risk of heart failure. They have faster progression of kidney disease. And they have more early heart and blood vessel damage. The risk is real, but diagnosis is often missed. Why does masked hypertension occur? Physical work and stress. Physically demanding jobs, long working hours, chronic psychosocial stress. Lifestyle triggers, high salt, alcohol, smoking, poor sleep. Nighttime hypertension, or what we say non-dipping. Blood pressure fails to fall during sleep as normally happens, and it is strongly linked to stroke and heart disease, and it is only detected by 24-hour BP monitoring. So this gives a false reassurance in clinics. Your BP in the clinic is okay, while at home and in real life the BP is high. Who is more likely to have masked hypertension? It is higher in men, people who are obese, smokers, people with diabetes, kidney disease, high stress occupation. So the normal clinic BP does not always mean low risk. What do the guidelines recommend? Home BP monitoring for people at risk. Ambulatory BP monitoring when symptoms or organ damage are unexplained. Out of office BP guidelines to guide treatment decisions. Masked hypertension cannot be detected without home or ambulatory BP monitoring. So what can you do today? Check your blood pressure at home, even when clinic readings are normal. You can measure frequently when you are at home. Pay attention to early morning or nighttime readings and share your BP log with your doctor. A normal clinic BP does not always mean safe. And to the healthcare providers, let us remember to encourage our patients to check and monitor their BPs at home. Masked hypertension is only diagnosed by home BP monitoring or ambulatory BP monitoring. So episode 6, we have learned 1 about white coat hypertension, which we saw is also an intermediate risk. When the BP is high in the doctor's office and normal at home, you are also at risk. The opposite is masked hypertension, when your BP is normal in the doctor's office and high at home, which is at very high risk because it is most of the time misdiagnosed and missed. Let us monitor our BPs at home. The key message coming in this hypertension awareness series persistently is the importance of home BP monitoring. If you have risk factors, even a normal person, hypertension is a silent killer. If you have not checked your BP recently, please go and get checked. Stay tuned for our next important episode where we learn about isolated systolic hypertension. Doc, only the top number is high. The BP is 165 over 60. Should you get worried? Isolated systolic hypertension. Dr. Muthui-Mutua, saving lives one heart at a time.